And just about anybody that has any major league illness, I feel it's always a good idea to speak with a psychologist. There are always concerns, not necessarily major league problems or anything like that. These are normal people in abnormal circumstances because of what's involved in adjusting to just hearing the word cancer in and of itself is majorly, it's emotionally charged. I have tools that I can provide people with that will make their lives better, will enhance and make things easier for them, help them process things with their spouses, with this, with that thing. It makes a real difference in people's lives. I personally feel there's only one kind of health, but people tend to break it down to mental health and physical health and stuff like that. The goal of saying these is to help them deal with the issues that oftentimes have never been presented before in their lives with. And a lot of stress, a lot of anxiety, help them get this under control. And in terms of interpersonal issues with children, with parents, with spouses, to help them work through the issues, to process their feelings, to deal with it. Some of them may be, in plain language, freaking out with diagnosis. It's very emotional, and they may feel like they can't sleep at night. Sometimes they can't eat or drink. Thoughts of being pushed and pulled. Everything, their whole lives flash around them, and they're concerned about what's going to happen. And it's a very stress, and they don't really know what to do. And they listen to the doctor, and it may offer them some choices, and which choice do you take? So it's a time that they're under tremendous pressure. A lot of patients will experience anxiety and depression, and oftentimes, if you go through some of these life, there are different times you get depressed. It's only normal to react to news that's negative with depression. In fact, I kind of worry more about people that don't. I mean, this is a normal it's an expected reaction, and it's so important to talk about it, and so many people just don't. And it's interesting in terms of support systems. There are some patients that feel they have very strong support systems and they don't want to see a psychologist, and that's fine. And other patients really do, and some patients feel that there's certain things that they can't share. But what a lot of people don't think of, there's specific things that I can do that normally, say your neighbor next door would not be able to. Like I work with clinical hypnosis and auto hypnosis, and I could teach people techniques for stress management. I could do all kinds of things, in terms of anti-anxiety things and building people up, preparing them for surgeries, for afterwards. And I love to teach people hypnosis, and then they're off on their own, and they could practice it every day if they like, or several times a week, or whatever. They set their own time. When you have somebody that doesn't have emotional support, and it's not an all or nothing. It's always a certain amount or whatever. And at different times there'll be a lot of support, and other times the other person will get depressed and pull back. And sometimes the patient has to go support the other thing. But I'm there, and I'm a professional, and I've been doing this for over 31 years. I know how to support people, how to help them get through it, and so to speak, psychologically take their hand and get them through the different issues, the angers. And sometimes, I might surprise you, but people feel guilt over this happening, and they wonder, what they're going to do. And in an odd kind of way, and I say an odd kind of way, because of the way it sounds, it's almost a window of opportunity. I wouldn't encourage anybody to get cancer just to have the window of opportunity, but it's a window of opportunity because it causes people to really re-examine their life and what life's about and their values and what they want. And we're better to discuss these things than with a psychologist, and then go on. And most people just go on. With major league, it changes their life. It's how they look at things. And I've seen it's such a tremendous enrichment after therapy. I said I wouldn't want anyone to come down with cancer, but if you can use it